The most vulnerable segments of the population, children and the elderly, are facing a growing threat from a silent and invisible killer, air pollution. Health experts in Ghana are sounding their alarm, calling on government and citizens to act to combat these deadly pollutants. Michael Ashali brings you the latest in our ongoing coverage of the critical issue of air quality in Ghana.
Accra is one of Africa's fastest growing cities. It seems that everyone in the capital is always on the move. But that very movement is putting them at risk. Air pollution is the second biggest threat to health in Ghana, according to the World Health Organization. Factories and waste burning are to blame for a lot of pollutants, but transport, especially the old fleet of trotros, is the biggest single contributor. Some of the particles emitted in this smoke are so tiny they can enter the bloodstream with lethal consequences over time.
It's not easy. It's a difficult moment. It's challenging breathing, especially at night when you are asleep.
Ruben Alexander has asthma, a life-threatening illness that constricts airways. Now 44 and an accountant with the University of Ghana Medical School in Kolebu, Otu says he was first diagnosed as a child. It was not a big surprise. Otu's mother had fought asthma for years before it finally took her life. Soon after, Otu's doctors told him he too had the disease. He is one of a growing number of Ghanaians with respiratory illnesses and a range of ailments, including heart conditions that doctors say are worsened by toxic air. Otu has to think all day, every day about avoiding triggers.
You encounter different kind of cars with their smoke from their exhaust pipes, very bad, and they are not the best.
The journey is far from comfortable, and with the emission of poisonous gas from the carbon-fueled engines, not even his nose mask can save him.
Protect myself from the dust in the system, the dust in the weather conditions in around here. It would help me to at least have a clean breath of air. So that's why I normally put on my nose mask. And especially when I use the trotro and stuff, people might come in with all sorts of perfumes in which might not be that best for me.
Air pollution has been associated with several diseases, notably respiratory diseases, acute ones as well as chronic respiratory disorders, lung function disorders, cardiovascular diseases, and even in recent times there are linkages with adverse reproductive health outcomes like miscarriages, low birth weight, premature deaths, and infertility in males.
Dr. Kao Osei has been monitoring the impact of air pollution on Ghana's growing population. He is the program manager of the Occupational and Environmental Health Unit at the Ghana Health Service. He says the effects of dirty air are far-reaching for many groups of Ghanaians.
We know that the children, usually are more vulnerable because their lungs are not well developed, and they stay closer to the ground where you have some of these pollutants in higher concentration. So they are more vulnerable, as well as the aged, the elderly, who are also not able to handle the effects of this air pollution, as well as the strong adults.